Hi, my name is Emily Carey, and I am going to be talking to you all about a public health issue. One of the greatest medical advancements of modern time is the development of vaccinations. With modern science and technology, we have managed to create vaccines for diseases that are now non-existent or close to it. Many vaccinations in the developed world are administered to children through a mandated schedule that was developed and tested by doctors and healthcare professionals. Unfortunately, this is not the case for children in developing nations throughout the world due to limited, if any, access at all to any vaccinations, and as a result, they are dying and falling ill to these preventable diseases. This is not only an issue for the children and members of these nations, but for the members of surrounding countries, and as a result, this disparity impacts global health. Policies need to be developed to provide assistance to these countries in the form of funding and allocating resources to get necessary vaccinations to children. According to the World Health Organization, childhood vaccinations prevent up to 2 million deaths worldwide per year. The caveat to this, unfortunately, is that throughout developing countries in Africa and Asia, there is still 2.5 million deaths per year from vaccine-preventable diseases in children 5 years old and younger. The purpose of this policy is to highlight the need for vaccinations for children of the developing nations. Vaccinations are the biggest source of protection from some of the most deadly viruses and bacteria in the world. Developing nations lack access and funding to receive the appropriate vaccines to protect themselves, leading to higher mortality rates and higher risk of keeping these diseases in circulation globally. To ensure the health of the children of these developing nations and the health of the global population, assistance must be provided in the form of adequate amounts of appropriate vaccinations, trained personnel to administer immunizations and provide community outreach, and funding for resources such as adequate storage and training programs to involve local healthcare professionals and public health workers with getting these communities properly immunized.